So with this knee, there's a post-surgical ankle. This patient has knee pain that she feels at night. Yes, like aching pain. The ankle surgery was about 6 months ago, and we're waiting for hardware to come out. But now we have a knee, and the knee orthopedically is intact. What we're finding, however, is on full extension, when it should normally anatomically lock with the tibial screw-home mechanism, on extension, I get a little bit of looseness. You can sort of see that, hopefully, on the video. There's looseness. So now we're going to do a little technique to tighten it up. So you can stop. So the technique is as follows. We're looking for the tibial tubercle on the back side of the tibial bone, on the tibial plateau. And to kind of locate the right spot, imagine that there's a circle here, and you want to split the circle, and you're going to feel right about there on the circle. You'll feel the prominence of the tibial bone, and as you flex the knee, you'll feel it sort of tuck away. That's how you kind of know you're on the right spot. And same on this side, about there. And the technique is as follows. You're going to protect your thumb with this rubber tip. You have to make your hand very flat all the way across. You have to hold that spot down. You have to lean, putting a lot of weight on. The original technique was taught as 80 pounds of pressure on the back of the knee. And then you're going to do a wrist flexion and extension maneuver where you're rocking over your thumb. This is the hand position, always. So the one thumb's going to rock over the other. And the wrist is going to end up from a flexed to an extended position, and it's going to strike against your thigh. I'm leaning against the table. If you want, you can back away and show how I'm leaning against the table a little bit. So this is the position. I'm going to end up striking against my thigh. Okay? Granted, it's the silliest technique to watch, but when it works well, it works really well. And it's very benign. You can't hurt anybody with this. I've done this hundreds and hundreds of times over the years. Old people, young people, people with Baker's cysts. So here goes. We're going to try it on this knee here. I'm going to lean and give it a thrust. And now we're going to go to the other spot. I'm going to lean and give it a thrust. So if you would, Nikki, turn over onto your back. Now let's just retest the knee. Hand goes on the top of the leg, below the knee joint. I'm going to bring in the full extension, and now I'm going to challenge it medially and laterally. So already I can't push it medially. I can't push it laterally, and I can only get a little bit out of it medially. So the knee is tighter. Oop. Let's compare this knee. Just relax for a short moment. Good, like that. Just for comparison, I can bring this knee into full extension, and I can't budge this at all laterally. I can't budge it at all medially. It's very tight, as it's supposed to be. And this one again, if I challenge it, I get a little tiny bit of give medially, but pretty tight laterally. Do you feel a difference from when we started, or no? Yeah? Okay. So the next question is, will this procedure of tightening the knee equate to symptomatic relief? That's something we'll find out.